Hi, welcome to the Elevating Aesthetics Podcast. I'm Brittany Perez.
And I'm Megan Theus.
And today we're going to talk about before and after photos.
Yes.
So what I wanted to do was tell you guys the do's and don'ts whenever we're talking about social media images specifically, but even just for the patient's chart. So I'll go through some do's and maybe you can go through some don'ts.
Yes.
Okay, awesome. My do's are always get photos on everyone no matter what, even if they're just in for a consult. One of the reasons that I like before photos is it is a medical procedure, and sometimes we think they're only here for a consult and then they get back and they add something and then we forget to take their photos. So it's best just to get it right off the bat.
Mm-hmm.
The other reason is it's really nice to use as a consultation tool whenever I have before photos. Sometimes the camera picks up on little asymmetries that my natural eye doesn't pick up on. So I will actually use it to show the patient, and then they can't really look at themselves in 3D. So I like to show them their side angles in full profile, and then they can really appreciate what I'm talking about, especially when we're talking about cheek augmentation or lip projection or chin projection. It really allows us to give them the full picture. The other do's are going to be consistent lighting. So we're using a ring light right now. I find that any type of really good natural lighting or using a ring light is important. If there's too much shadowing on the image, you just can't really get a good picture for shadowing under the eyes or fine lines and wrinkles. So I think lighting is super important. What are a couple of your don'ts?
First and foremost, I think it's also really important for the patient to be able to see when they come back for follow-up. They may not, because they see themselves every day, be able to tell a difference until they see the before and after side by side. And I have had so many patients that maybe didn't think that their treatment was as great as it was. When they see it and they're like, oh, I love this.
In the pudding.
Yes, side by side's amazing. Don'ts, I think, and I was just talking about this yesterday when we were at dinner, sometimes it can be deceiving if you post before and after photos and you don't have the same angles. So I feel like making sure that you're consistent and not taking your after photos at a different angle than your before photos.
Yes.
Because, I mean, just as much as like this can, versus a patient after like this, I mean, it's going to look different. It's going to look completely different. Obviously, make sure you're at the same angle in the before and the after. Lighting is important, and makeup.
Yes.
And I actually forget sometimes because patients will come here from work and they have a full face of makeup. And before photos for lips, they tend to have lipstick on, and then after, and it makes a difference because they may line their lips a certain way because of asymmetries, and so it's really hard when you do an after photo if the before photo they're wearing makeup. So
100%. Some other do's for me are going to be imaging software. So you don't necessarily have to have Vizia. We love Vizia because it shows us the pores, the texture, the pigment, the redness. But you need some type of consistent software so that you're not looking on different devices and you're not having to scroll through your cell phone. So whether it is a dedicated iPad that you have a Google Drive on, whether it is your EMR software where you store your photos, or something like Vizia, you do want something that is going to be consistent so you're not having to search everywhere when you're trying to get that really good before and after photo. And then something else that I recommend, thinking of social media, because that is where we're using the photos a lot, is do make sure that you show the difference between the before and the after, and say like, this is the before, this is the after, because some people don't have the aesthetic eye. So it's really nice to tell them what's the before, what's the after, and then give a little explanation in the caption to say, this is what the patient had done, because, Megan and I can probably look at a photo and be like, oh, she had her anterior cheeks done, or, she had her temples done, but it takes too long for the average person to assess what the patient had done. You want to quickly help them identify what the patient did, and by giving a description and a caption, that really helps.
Especially if it's a subtle change.
Yes.
Like, we see those things because we look at faces all day long, but if it's just a natural subtle change, if you don't point that out to someone, even the patient, it can be very hard for them to see. So I do agree that an explanation and not just a before and after is important. I also think, and I want to get your thoughts on this, injectors always post after photos immediately after the treatment, but I also think that it's important to post some follow-up photos.
Absolutely.
Healed lips look completely different than lips that were injected 25 seconds ago. So
Any area, right?
Any area,
I'm really big on authenticity, and I think that part of that is showing your healed results, because sometimes we do have unanticipated things that happen. Like maybe they do have a little bit of asymmetry after because they had bruising on one side and you had to come back and touch it up, or maybe they have a teeny tiny bump that you had to massage out or do like 1 unit of Hylenex to. There's so many different scenarios, but I think showing healed results, ultimately the patients don't know that's what they want to see, but ultimately that is what they want to see, because you can give them unrealistic expectations.
Absolutely.
If you have a patient and you show, this is my 1 syringe of lip filler, and their friend comes in, right? They're like, oh, I want that 1 syringe that my friend had that looked perfect afterwards, then they're not really appreciating that 50% of that was volume from swelling.
Absolutely. And how much different they look when it settles, because that 2-week time frame, there's so many changes, not just from the swelling, but as the filler's integrating into the lip tissue, and it just looks different. And I think it's important, and I don't know that patients, because I've had people come in and they're like, I want this person's lips, and it'll be an after photo that I just did and the lips were so fresh, and I'm like, these are swollen. We might can get there depending on, you know, how their lips look, but these are swollen lips, and they change so much.
They change so much, and so that would be a do for me, is have your patients back for filler procedures at 4 weeks. I feel like a lot of times people will see their patients back at 2 weeks, but ultimately, if you palpate the lips and they're tender at all to the patient, which a lot of times at 2 weeks they're still tender, they should not be getting additional filler. They still have an inflammatory response, and are more likely to create nodules, lumps, and bumps in lips if they're not completely settled. And that typically takes 4 weeks. Now, in some people, it takes a little bit longer. So really the best way to know is to palpate the lips and ask them, do you have any tenderness with palpation? That's your answer. So do have them come back at 4 weeks for follow-up instead of 2 weeks.
Right. And I also think that, and we just talked about implementing this at Mila, that we're very consistent with all of our injectors.
Yes.
With our before and after photos, because we want it to all look the same. Whether that be in this room with the ring light, or if we're all busy and we can't get in here, making sure that the before and afters are in the same room. Like my patients' before photos are on that same wall every single time, because I know the lighting.
Yeah, and that is a good point, because if you have an injection room that has a window and you see the patient initially at 9 a.m. and the second time at 5 p.m. for their follow-up, the lighting's going to be different. So ideally you have a room without windows, or your window has a shade so that all your lighting can be consistent.
Yes, and I've been blessed because I don't have the window light in my room, but I know on that one wall it's like the brightest light and there's no shadowing, so they'll like be on this wall and I'm like, no, come over here, because I want it to be the same, so that it's so consistent when I post it side by side. So, and I've actually not posted a before and after because the angle was off, and I'm like, I don't want people to think that this is me trying to say, oh, look at this, yes, like a trick, because it does look like a trick.
Yes.
When you post especially if you do like a chin or a jaw.
Yeah.
And the first one's like,
you're like, dang.
or they tuck it just a little bit, and then it looks like they did a full like chin og.
And I don't think it's intentional a lot of times.
No.
So I don't think people are intentionally doing that, but it's accidental, and it looks to the patient like you're trying to be deceiving.
Yes.
So I think that's so important. Another do that we almost touched on is angles, but also positioning and animation of the face.
Yes.
If you have before photos of the cheeks or the lips or the chin, you want to make sure, I like to take my photos at rest, so I'll have them closed, slightly open, and smiling, because that allows you to see all the faces that patients are going to make. And I like to have those smiling before photos as well, because you can see if one side of their lip drops down more than the other, or if one side of their cheek lifts up more. And again, something that your natural eye wouldn't catch, you can see with a photo. My one don't that I will add, and I have seen this as well, is don't add filters to your photos on social media. It's fine, you know, if you're posting a quick story, but if you're trying to show your work, please don't use filters, because it is confusing. Now, I have seen people, I've actually had requests myself and have done this. If someone has some mustache hair or something like that, and they want me to clean up the mustache hair, I've done that once or twice, but don't edit your work, because that also is deceiving and it's unfair to the patient. And really, you want to be authentic. The most important thing in our industry is being authentic.
Yeah, I did an after photo that stuck.
I just didn't want to hit
the
your
wild hair. I had an after video, because I do like to take videos too.
I love videos.
I think after videos
It's a do.
Is a do, yes, because you can see it from all angles. And that side profile is so pretty to me, and I love to post that. But I had one where there was a shadow from my ring light in my phone, so I use like a brighter filter. It's just the lighting that sometimes I edit because of the shadowing. but it's only because I'm right over them with a phone and that light makes it. And I think sometimes you should do that so you don't have the shadows. But I do agree with editing photos, and it just looks deceiving. Yeah,
yes.
I don't.
Amazing. If you have any questions, if you're an injector or you're a med spa owner and you want to learn how to do more consistent photographs, we do have a course through Method that has all of the imagery, and it's just a downloadable PDF as well that we could send you. So reach out to us. We're happy to help. Do you have anything else to add?
Yeah. Oh, we actually had an injector. It was Andrea when she was here with our duty day, and how important like teaching how to take photos, because before and after photos are so huge, because that's the biggest part of our social media. Obviously we like to educate, but showing what services and treatments we offer and what that looks like. And so I feel like making sure that your photos are as close to perfect as they can be is so important. And Method, we've been trying to get a whole course on that, just teaching medical assistants and RNs and other injectors how to do their photos, because it's a big deal.
We do have a webinar coming up actually this Friday from 12 to 4, and it is marketing and social media. So if you do that webinar, you do get the PDF drop. So that is an option as well. It's $250.
That's awesome. I love it.
Amazing. All right. If you guys have any questions about before and after do and don'ts, let us know.